We'll start with the Waldeyer's lymphatic ring topics. In this session, we are discussing about two gross topics. The first one is Waldeyer's lymphatic ring and the second one is auditory tube. If I am not wrong, this is the second session for Waldeyer's ring, right? It is already finished. This topic is finished or not? This is the first session? Okay. Where we can see the Waldeyer's lymphatic ring? Any idea? Palate. Okay. Any other answers? Stop talking, everyone. Where we can see the Waldeyer's lymphatic ring? Your Waldeyer's ring is the component of MALT. So what exactly is MALT? MALT is known as Mucosa-Associated Lymphoid Tissue. So what is the division of lymphoid tissue? How we divide the lymphoid tissue? Stop talking. Your Waldeyer's lymphatic ring is the component of mucosa, and we all know MALT, and MALT stand for Mucosa-Associated Lymphoid Tissue. So if you remember the general anatomy concept of lymphoid tissue, how do we divide the lymphoid tissue? What are the categories we see in the lymphoid tissue? Okay, very good. We see primary and secondary. We called it as primary lymphoid tissue sometimes, and sometimes it is called as primary lymphoid organs or secondary lymphoid organs. On what basis we divide them into primary and secondary? On what basis we categorize them into primary lymphoid tissue and secondary lymphoid tissue? On what basis we divide them into primary and secondary types? It's just a general anatomy topic. Okay, at least what do you mean by lymphoid tissue? What is the definition for lymphoid tissue? What is the significance of lymphoid tissue? Okay, any examples for lymphoid tissue at least? Okay. Okay. Can you tell some example for primary lymphoid tissue? Which one? Thymus. Say it louder, please. Thymus. Thymus. Okay. What about the secondary lymphoid tissue? Example? Palatine fossa. Okay. Palatine fossa. Is it right? Spleen. Okay. Any other examples? Tonsils. Okay. So if these are the examples, how do you classify these two categories? What is the basis? What is the difference between this lymphoid tissue and this lymphoid tissue? Everyone just go and try to brush up the old topic lymphoid tissue, okay? So in the secondary lymphoid tissue, we have two categories. Those are capsulated lymphoid tissue and uncapsulated lymphoid tissue. Okay, if your lymphoid aggregations are present like this, it will be surrounded by which tissue? It will be surrounded by connective tissue. This type of lymph nodes or lymph organs are called as capsulated lymphoid tissue, and another one is uncapsulated one. The example for uncapsulated one is your MALT. And example for capsulated one is your spleen. Okay, so your MALT is the uncapsulated lymphoid tissue. So where we can see these types of lymphoid tissues? In which part of our body it is present? These type of uncapsulated lymphoid tissues are present in the mucosa and submucosa of your GIT, respiratory tract, and also your genitourinary tract. Okay. Based on the regions it is present, it will be divided into two more categories. The first one is GALT, it is also called as GALT, stop talking, and the another one is BALT or NALT. Okay. GALT means gut associated lymphoid tissue, and BALT means bronchus associated lymphoid tissue. NALT stands for nasal associated lymphoid tissue. Example for bronchus and nasal associated lymphoid tissue is your Waldeyer's ring. What about the example for gut associated lymphoid tissue? Development of GIT and also gross part of GIT is finished, right? So what type of lymphoid tissue you see there? Any example you remember? Peyer's patch, very good. Peyer's patch is one example for your gut associated lymphoid tissue. Okay. So whenever you are writing about Waldeyer's ring, you have to mention about the concept MALT. So remember, your Waldeyer's ring is the component of MALT. MALT stands for Mucosa-Associated Lymphoid Tissue. Okay. In the secondary type of lymphoid tissue, we have two categories, capsulated and uncapsulated lymphoid tissue. Your MALT is an example for uncapsulated lymphoid tissue. Okay. Based on the regions it is present, it is divided into GALT and BALT. In few textbook it is also mentioned as NALT. So GALT stands for gut associated lymphoid tissue, BALT stands for bronchus, and NALT stands for nasal associated lymphoid tissue. The example for your bronchus associated lymphoid tissue is your Waldeyer's ring, and for gut associated lymphoid tissue we have Peyer's patch as an example. Okay. Any doubts in this? Any doubts? So what is the function of your Waldeyer's ring then? If it is present in the mucosa and submucosa layer part, what is the function or what its significance if it is present in the mucosa and submucosa lining part? It provides protection. So it acts as a defense mechanism for the foreign particles entering into your air and food pipe. Okay. Any doubts in this? Any doubts? No doubts? Okay. So now imagine this is the side view of your nasal part, that is the nose, followed by palate, and here we have the tongue region. On the tongue part we have anterior 2/3 and posterior 1/3 part. Okay, this is the nasal part and this is the palate and this is the tongue region. Okay, on the nasal part here we have the nasopharyngeal tonsil. Okay, beneath the nasopharyngeal tonsil we have what opening? What opening is present? It is the tubal opening or tubal elevation. In few textbook it is mentioned as tubal elevation. Okay. So here we can see tubal tonsil. And on the palate region we have stop talking, third bench, palatine tonsil. Okay. And on the posterior 1/3 of your tongue region we can see which tonsil? Which tonsil is present in the posterior 2/3 part of the tongue? It is your lingual tonsil. Okay. This is how the side view of your tonsils will look. If I look it from the front view, this is how exactly it is present. This is your nasopharyngeal tonsil, the first one, and your tubal tonsil and palatine tonsil are present on the both the sides. So it will be present like this. This is the tubal tonsil, the second one. Okay. Next we have palate region here, followed by the tongue part. So on palate region on both the sides we have palatine tonsils, and on the tongue part we can see the lingual tonsil here. Okay. So if I join all these tonsils, it will form the inner ring of your Waldeyer's lymphatic ring. Others, please concentrate this side. So this is your nasopharyngeal tonsil. On both the sides we have tubal tonsils. Next to that on the palate region we will get palatine tonsil, and the last one is lingual tonsil. All these tonsils will together form the Waldeyer's lymphatic ring part. Okay. So this is the inner ring. In most of your textbook they have mentioned only about the inner ring part. So if in your exam or test if you write only the inner ring part, more than enough. But for your MCQ purpose I will mention about the outer ring part also. So this will be your outer ring. This will be the outer ring. This outer ring is constituted by the, stop talking others, constituted by the lymph nodes present in your neck region. Okay. So what are all the lymph nodes we see in the neck region? What are all the lymph nodes we see in the neck region? The very first one is retropharyngeal node, to which your first and second lymph nodes will drain. That means to your retropharyngeal node, your nasopharyngeal and tubal tonsil or lymphatics will drain into that node. Okay. Then followed by this will be your jugular digastric node. Jugular digastric node, to which your palatine lymph nodes will drain. Okay. Followed by jugular digastric we have a chain of nodes. What is this chain is called? What is this chain is called? Jugular lymph node chains. Okay. Below this lymph chain we have submandibular node, and in the center we have submental node. Okay. This is the outer ring picture of your Waldeyer's lymphatic ring. So your outer ring is constituted by the lymph node present in your neck region. We will start with the retropharyngeal node, to which your first and second limbs will drain. Then we have jugular digastric one, to which your palatine lymph nodes will drain, followed by we have submandibular and submental nodes. Between the jugular digastric and your submandibular node, we can see the chain nodes, that is called as the jugular lymph node chains. This is called as upper node, middle node and lower node. Okay. This is the old picture of your lymphatic, Waldeyer's lymphatic ring. Any doubts? Any doubts in this? Okay. The aggregation of lymphoid tissues underneath the epithelial lining of your pharyngeal wall called tonsils surround the commencement of air and foot passages. This aggregation together constituted an interrupted circle called Waldeyer's ring, which forms the special feature on the interior of your pharynx part. The Waldeyer's ring is mainly formed by 4 tonsils: pharyngeal tonsil, which is present posterior-superiorly, then we have lingual tonsil, which is present anteriorly, and tubal and palatine tonsil, which is present on the lateral sides. Okay. It is thought that Waldeyer's ring prevents the invasion of microorganisms from entering into your air and foot passages, and this helps in the defense mechanism of the respiratory and alimentary systems. So this is the inner ring picture which I have drawn here. You can see the structure and compare with this part. Take 2 minutes and compare the structures once. In few textbooks, the tubal opening is also mentioned as tubal elevations. Okay. Any doubts? Any doubts in the figure? Any doubts? Okay. The one clinical condition is tonsillectomy. So what do you mean by tonsillectomy? It is the surgical removal of your tonsil part is called tonsillectomy. So when they were removing the tonsil, what are all the arteries and veins to be preserved? Any idea? Which artery to be preserved? Tonsils classes is finished, right? Tonsil classes are finished or not? Yes. Okay. Okay, then tell me which arteries and veins should be preserved during the tonsillectomy procedure. Tonsillectomy, you will get MCQ question for sure. It is very important. You should know which artery, which vein and which nerve to be preserved during this particular procedure. Okay. So bleeding from tonsillar fossa after tonsillectomy, it most commonly occurs due to the damage of parotonsillar vein. The blood clots should be removed in order to check bleeding. If not removed, they interfere with the retraction of the vessel walls by preventing the contraction of the surrounding muscles. So which muscles will be present in this area? Which muscles are present in this particular area? it is mentioned that the contraction of surrounding muscles will also takes place. So what are all the muscles we can see here? Superior constrictor, okay. Palatoglossus. Any other muscles? The post-operative edema of tonsillar bed after tonsillectomy can affect your glossopharyngeal nerve also, leading to the loss of sensation in the posterior 1/3 of your tongue region. So during the tonsillectomy procedure, you have to preserve your paratonsillar vein, glossopharyngeal nerve, and which artery. Take it as an assignment question, find out which artery should be preserved during the tonsillectomy procedure, okay. The next topic is auditory tube. So where we can see the auditory tube? Your auditory tube, in this figure, the blue part and the yellow part represent your auditory tube. It is present or it connects your middle ear and also your nasopharynx part. So auditory tube is a tubular structure that present or connects your middle ear cavity and also your nasopharynx. The whole structure is around 4 cm in length and we will divide it into two parts. The first part is cartilaginous part and the second part is bony part. The cartilaginous part is present in the anterior aspect and towards the medial side. So it is called as cartilaginous part is present anteromedially and it is around 24 mm in length, okay. And the bony part is present on the posterior aspect and towards the lateral side. So it is mentioned that bony part is present posterolaterally and it is around 12 mm in length, okay. So your auditory tube connects the middle ear cavity and nasopharynx. Total it is around 4 cm long. It has two parts, cartilaginous part and bony part. The cartilaginous part is present anteromedially and it is around 24 mm in length, whereas your bony part is present posterolaterally and it is around 12 mm in length, okay. And this your whole auditory tube have two ends. The first one is tympanic end and the another one is pharyngeal end. The pharyngeal end is a slit-like structure which is present vertically and it is larger in size compared to your tympanic end. Your tympanic end is more like a tubular structure which is smaller compared to your pharyngeal end. And your tubular end is associated with the which wall of the middle ear? Anterior wall of the middle ear, and your pharyngeal end is associated with lateral wall of the pharynx. These are the few important points you should remember about the auditory tube. Your auditory tube have two ends, pharyngeal end and another one is tympanic end. Pharyngeal end is slit-like structure present vertically and it is larger in size and it is associated with the lateral wall of the pharynx. Whereas your tympanic end is tubular structure which is smaller in size compared to the pharyngeal end and it is associated with the anterior wall of the middle ear part, okay. And this entire tube is lined by which cells? This is present between your middle ear, you can see here middle ear cavity and in between the nasopharynx. So which type, stop talking, which type of cells are required here? Nasopharynx means it is the air passage, right? So what kind of cells are present here? Do we need ciliated cells or non-ciliated cells in this area? Ciliated cells, right? So we need columnar or cuboidal? Your auditory tube is lined by pseudo-stratified ciliated columnar cells. Okay. Any doubts in this figure? Any doubts in this figure? No doubts? Okay. Your auditory tube is also called as pharyngotympanic tube. It is a mucus-lined osteocartilaginous channel which connects the nasopharynx with the tympanic cavity, that is your middle ear cavity. It maintains the equilibrium of air passage on either side of the tympanic membrane for its proper vibration. In an adult, it is about 36 mm long, that is around 4 cm, and it will run downwards, forwards and medially from its tympanic end part. It has two parts. The first one is bony part and the second one is cartilaginous part. The bony part is posterolateral part and forms the 1/3 of the total length of the tube. It lies between the tympanic and petrous parts of the temporal bone and opens into the middle ear cavity. Your cartilaginous part is present anteromedially and it forms the 2/3 of the entire tube. The two parts meet at isthmus, which is the narrowest part of the tube. So, this part where the two parts of your auditory tube is meeting, this is called as isthmus part. Okay. Ends of the tube, we have two ends. The first one is tympanic end and the another one is pharyngeal end. The tympanic end of the tube is small and it is bony structure. It is situated in the anterior wall of the middle ear, just little above its floor part, and the pharyngeal end is relatively large and a slit-like structure which is present vertically. It is situated in the lateral wall of the pharynx about 1.25 cm behind the posterior end of the inferior nasal concha. Lining of the tube. The entire tube is lined by a pseudo-stratified ciliated columnar epithelial cells. Okay. The cilia here beat in the direction of nasopharynx and thus helps to drain the secretions and fluid from the middle ear into your nasopharynx region. So, this is the difference between the adult and infant auditory tube. Take a minute and read the entire tabular column. The direction point is from your tympanic end to pharyngeal end, not from pharyngeal end to tympanic end. Keep this in mind. Here the direction will be always mentioned from the tympanic end to your pharyngeal end, okay? Because here the fluids and the secretions are bringing from middle ear region to the nasopharynx, not from the nasopharynx to the middle ear part. That's why. What do you mean by angulation? During the mandible explanation, they would have definitely mentioned about angulation. Have you studied any angulation in the mandible at least? Yes. What angulations you have studied? Okay. So, can you define angulation in simple terms? Angle present between the two surfaces. Okay, right. So, in the infant auditory tube, you cannot see any kind of angulation in the isthmus part. Isthmus part is nothing but where your cartilaginous part and your bony part are meeting with each other. But in adults, you can easily identify the angulation presence. Okay. The last one is clinical correlation for your auditory tube. Since the auditory tube is shorter, wider and more horizontal in the infants, the infection from nasopharynx can easily reach the middle ear cavity. For this reason, middle ear infections are more common in the infants and also in the younger children than the adults. Okay. So, this finishes your Waldeyer's lymphatic ring and also auditory tube. Both are very simple topics and very important for your MCQ purpose. Okay. If any doubts, you can come and discuss with me later. Thank you.